founder and CEO of Project 8P, and Issa Woody is right here, founder and president of Ring14 USA. And we've kind of put us all together in one room right now because we really wanted to talk about the data and how, you know, we're all contributing to research right now and how we can really have that accessible and inform us today, and not necessarily think about, oh, we're giving a lot of information and we're spending a lot of our energy and effort to participate, and we may never actually see the fruits of that. And we want to make sure that we see the fruits of that in real time now. And so we're changing the way that we're designing the infrastructure of a data platform. And some of you have participated in our registry so far. And so we have Jason Colquitt. Come on down, you're the next contestant. CEO of Across Healthcare, who is somebody who has so much expertise over almost 2 decades in EHR, EMR, medical records, and personally has a passion to really help the rare disease community by a platform called Matrix. Really, it's a company, and how we can connect the dots of all of this data, right? We have so much information, and how can we make meaningful sense of that? And so Jason has been amazing because anytime I have a question, is this possible? Can we actually see our medical records right in the palm of my hand? When we participate in research, can we connect that? When my blood draw is getting processed somewhere else, can I actually see the process of where that is? And Jason always says yes, and usually says, yes, I can do that in 48 hours. And so we're really just excited to hear from Jason, and of course our beloved Dr. Scott Demarest, clinical director of our neurogenetics multidisciplinary clinic at Children's Hospital of Colorado. Some of you may have seen him and heard him on the neurology panel today, but he has the greatest heart and is so incredibly wise about this area of neurology and epilepsy, and dedicated to helping us as 8P families and Ring14 families. And so we're just so grateful to have you guys, and I know there's lots, so I will give you the mic and I will step away. But I need my phone.
Great. Thank you for that kind introduction. So this session is Bina's conception, so we're trying to do it honor in terms of what we want to try to convey to all of you and have time to answer your questions also. I think that kind of comes in 2 parts. One is jumping directly off the prior session, multidisciplinary care, designated clinics where we're bringing together cohorts of patients. What does that offer us in terms of opportunities for research? I'll kind of address some of that. And then there's a little bit of the like, well, how do you do it side of things, which is our technology partner here, who's going to answer some of those things. So this is what I do. I'm a clinical researcher for rare diseases and neurogenetic conditions. I am very interested in trying to figure out all the kinds of questions that you guys have been asking today, only with hopefully being able to provide better answers. So what are the issues you have? What ages do they develop? Do they come? Do they go? How severe are they in one patient versus another patient? We kind of group all of that together into what we call natural history studies. And that's really a mapping out of the challenges that a patient might have in a particular condition over their lifespan and the ranges of severity of those conditions. That's a critical first step to starting to be able to understand what are appropriate guidelines for care. What things do we need to be watching for at what ages? How do we measure success in a particular patient? What things are modifiable with the appropriate interventions? If you don't really sort of understand the landscape to begin with, it's hard to start to get to that next level. It also is really important for what we all hope eventually is coming down the line, which is new drugs and treatments and technologies that allow us to alter that course for the better in a meaningful way. And if we don't know what the typical is, then how are we going to really know whether we're changing it in a meaningful way? So those are sort of the scope of things that I'm involved with. across a bunch of different disorders. I'm really excited with 8P and Ring14 that we get to start to answer those questions by bringing patients together at our site to start, hopefully other sites in the future. This isn't something you can do with just one site in a rare disease. And there's a learning curve to this. So some of this is, I can look at various other neurogenetic conditions and say, oh, we're gonna need to pay attention to these things. And we talked about that throughout the day. We talked about the various issues that happen in these conditions. But as you start to see more and more patients, you start to go, well, I could be a little more specific about my questions. How does this relate to that? How is this different in this specific subgroup of patients that Wendy Chung mentioned? Is this group a little bit different in their severity for a particular issue? And then you can start to drill in on that. It also is a way that we can start to go through some of the mechanics of clinical research. And that's really informing families of what we're going to do. How do we intend to use data? Getting your consent to do that, and having contact with you to be able to do that over time. And then getting that data into databases where people can look at that data, use that data in various ways. So that all actually takes an incredible amount of effort. I've done that as like the primary site, setting up an entire infrastructure for a whole network. It is exhausting, and it's it's like banging your head against the wall. I don't envy people who have to do that. And as a clinician, I don't want to spend my time doing that. I want to spend my time seeing patients and doing the analysis, asking the right questions, not dealing with the infrastructure behind something. And this is a really great partnership that Bina came to us and said, hey, we'll take care of that. We want you to do what you do, and we'll take care of the infrastructure side. And that's where, at least in part, Matrix comes in and bringing them on board to help with some of that infrastructure behind the scene. And so with that as sort of a broad introduction to our side of things and why we're doing what we're doing and why we've asked everybody to consent to research, I'll turn it over and let you kind of talk about what you guys do, and then we can field questions if that works for everybody.
So first of all, thank you. This is an honor to be on stage talking to you guys. I had a vision about 2.5 years ago to build a platform specifically for rare disease patients and to just blow it out of the water of what could be done, because there's not a lot of people that are actually just focused in rare disease on the software technology. So that's my background. I don't pretend to, even though I've worked in healthcare for 22 years, I don't pretend to be a clinician or a scientist. I'll leave that work to them, but I want to make the best technology possible. And as Bina said, there are, she made it sound really easy, but if anybody tells you it's easy, you probably should run, because it's hugely difficult. I built EHRs for 12 years, so I know what that life is like. I worked in clinical research at the world's largest global research organization for 6 years, running global registries, and got introduced to folks like Cystic Fibrosis Foundation. So if you look at rare disease in the model that they have, it's pretty impressive. And I ran all of their technology behind it. So they actually introduced me to a concept called co-production of care. This is where everybody contributes. This is the cool thing that I love about rare disease. So Dr. Demarest can get up here and talk. You guys have to participate as caregivers. There has to be patients. So it's a whole circle, and everybody's got to be contributing. So that's the kind of system that I wanted to build. And when we talk about data, there's data that's flowing from the healthcare professionals that see your kids. There's data that comes from you yourself, because you see things that are happening all the time. And there's just all this bolus of data. So we created the platform. So hopefully some of you have seen my face and consented to research over there. That's kind of the painful part of the system, hopefully, and the best is yet to come. But we have a system that's built around everything that I'm talking about. That's built around that concept of co-production of care, so that clinicians can enter their data and researchers can enter data, where patients and caregivers, as you're going through your daily lives, seeing, symptoms and activities, that you can track those systems, everything going on with your patient. Also, as Bina mentioned, we do have, I kind of stayed away from EHR because it is tough, but we've introduced so that you as a caregiver can create links into all your patient portals, and on every 7 days, we pull that data so that you can have that. And I've worked with a lot of people that their patients are like 27 years old, 30 years old, and they have the notebooks, the binders, the paper, everything for 27 years. And it brings me to tears when they see a system like ours that can aggregate all that. So for the first year and a half of our platform, we focused on what tools could we give patients to collect data. And we heard, give me medication tracking, adherence piece to that, but also the simple things that the clinicians may not think about. No disrespect, but like some of my kids that are on our platform are on 40 meds. So when are those going, when are they expiring, or, I need to call the pharmacist or the clinician to get a refill? That's a simple thing that you would think, but if your kid's on 40 meds and those are all on some different frequency, that's a big deal. So that's some of the stuff that we do. Journaling, uploaded videos, stuff going on at school. I want school forms uploaded. This is all the stuff that I hadn't ever seen. You could probably find one app that does a piece of that, but bring it all together into one thing. So that's what we're about at Matrix. I have 65 people that work for me. We all come from a healthcare background, and we love what we do. And we're here we say we don't have it all figured out, but we're in a journey to figure this out over time with groups like yours. So I can talk about data forever and bore you from a technology standpoint, but I just wanted to get those points across. It's everybody contributing data, and it's as Dr. Demarest mentioned, it's creating these standards of what is that natural history and what is the progression, and when we start introducing therapies, how does that change things? So I'm a technologist that loves contributing to the rare disease space, and we'll keep doing that. So with that, I'll stop and see if there's questions, but I actually I can show my platform. I don't know that anybody wants to see it, but happy to do that. And just so you know, after that's actually where I was just going. So great question. You will get an email invite. You should know if you signed up what your email and password is. It was standard. We created a standard password. So if you forget that and want to come by and let us tell you that, but you will have access to it. So you will get an email, and there's actually patient reported forms. So you will get emails to complete some forms after the conference that are, that you will fill in the entry of that you haven't seen yet, but that are coming. And you saw some of it. We went to the consent form and we bypassed all those forms, but you will get an opportunity to complete those assessments at your leisure after the conference. So from a technology perspective, I will say our platform is super open. You can invite clinicians, but the consents and the way who can see what is managed outside of us from the technology perspective. And there's guidelines that we have to follow as far as that's concerned.
There's a part we're kind of ignoring in this whole conversation, which is governance. And what we mean by governance is, are we getting consent to do what you say is okay to do with your data? And are we making sure that we're only doing that? And that's a tricky thing. You've all heard of HIPAA, right? We want to make sure that we are honoring what you want done with it and only doing that, but also making it so that we can actually be productive with it, right? And so there's a little bit of a challenge there, and governance ends up getting really complicated really quickly. Bina's actually the one who's really in the trenches with this, so I'm gonna let her answer that specific question.
Well, I'll add to that. I mean, I think the most important thing is for the principal investigators, you know, the people that are making the decisions that put together, and we've talked briefly about this, but what's called like an IRB, there's a protocol. And so that has to actually get approved. And then we must comply with that. And so whatever we spell out and list out in terms of our intentions still has to be an option for each of you to be very informed, have all the education about what you're deciding to contribute to, what you're deciding to share, and know how that information would be utilized by a clinician, by a researcher, and potentially other stakeholders. And so that's a really important conversation that we will have, and it'll be ongoing. And we will continue to have that in our communities, because things change, right? Like what we thought we wanted to know might change. Just even the example of genetic testing. We have AP families that were able to do some advanced testing and found out they have things not in the AP region that are affecting them, right? And so that changes what you may opt into or what information you may want to see. And so this is a journey together, right? There's no decisions are permanent, and there has to be fluidity to this. And this is true partnership, right? Everything that we talk about, the foundation processes, and we talk to our board members who are here in the room, and we talk to our medical and scientific advisory board members, and really try to make the right decisions to achieve some of the goals that we've all put together collectively. So, you know, we're not talking about that right now. We're talking about just the features and why it can really help us organize all of our information. But you know, the governance and the consenting is extremely important, and we will continue having those conversations. So yeah, I don't want to make light of that.
Yeah, and the one part I would say is, so I kind of have an aspirational vision about how this works across rare disease, where like everything is connected. So all the people you want to have the information all have it. So if you guys are doing a questionnaire directly to families, but it might be useful for us to actually know that before you come into clinic, we could see that and then save us, 15 minutes of asking you the questions that you just answered, right? And similarly, if I ask you a bunch of things in the clinic, they want to know it too for research purposes, right? So the idea of the efficiencies of it in you guys' complex lives sounds wonderful, but we have to do it in a way that is also protected. And that's a balancing act, because we can kind of protect you in a way where we say, we give you the option for this, but we don't want to give you an option that just like writes a blank check. But we also don't want to be coming back to you every month and saying, hey, can we do this with it? Hey, can we do this with it? So there's a bit of a balancing act there that we're trying to do as well as we can, I guess is what I'd say.
I'll also hit on, you guys might not understand the complexity of when you ask a question, how you have to link that. So if a question's asked and you want to be able to use that meaningfully, it has to be standardized. So there's a lot of work behind the scenes. That's the dirty job of, how do we want to ask this question so we know the answer and it's standardized across the board. So there's a lot of work underneath these systems like ours, and globally we work with, that try to standardize those answers and question sets. So you only ask it once. It means the same thing everywhere. Because if we all in this room collectively came out with 100 questions we wanted to ask, what's the chances that they're going to match anybody else that sat in a room like this and created 100 questions and answers? So that's another part that's kind of the behind the scenes that has to work.
Yes. Let me try to pass them mic actually. You can, okay, and then I'll repeat it.
I also put in more complex data like MRIs or EEG that can be used for research afterwards. Sites.
Yes, we upload, so we do no diagnostic level viewing of those, but we store all of those type files, EEGs, MRIs, so we can facilitate all of that.
Some of those are a little more complicated on the site side in terms of they're not always stored just right in the EHR, right? They have other systems often, and but yes.
And we'll try to facilitate, like, I mean, I have a DVD of my daughter's MRI, so I could potentially figure out a way that that gets uploaded into the system, right? And so we're working out some of those kinks. I know Jason doesn't want to receive 100 DVDs in the mail, and can't do that actually. So, but we'll try to figure that out. He's gonna say,
I'm ready.
"No."
2 minutes, 48 hours, you said? No. No, and the complicated thing on MRIs is you have to know the software it came from to be able to view it back. So that's when I say it seems simple that we should all just get along and use one system, but it's not like that in reality. So all MRIs are different
Yeah,
in some
no,
regards.
Isa?
Yeah, I have one other question. I'm gonna put Nina on the spot, but it's community, everything is that, what if we're not at this point with our child? Is there still an opportunity?
Since you asked that question, it seems appropriate to repeat it
Yeah.
so that people not at this conference can hear it. The question was, what if we're not at the conference? How do we get involved with this? How do we contribute data?
Do you want to take that from the clinical side of research?
So there's a couple of ways from the interaction with clinician side of things. So one, you can always come to our clinic. We'd love to have you. We know this may not have worked in terms of timing, but there may be other times that you can, and that would be wonderful. Also, we're working on ways that we can do what we call tele-research visits. We're not calling them telehealth visits. And we have to be very careful about that. A clinical interaction has a lot of regulations associated with it, malpractice, where I'm licensed, things like that. So going across state borders becomes challenging. Despite COVID and COVID making everything easier for telehealth visits, there's a lot of barriers still. But the collection of research data is possible in tele-research visits. Unfortunately, the reality of that distinction, the biggest part of that is that I can't be making medical advice as a physician in a tele-research visit. It's me getting information from someone. And so I'd like for this to try to make this a two-way street. I want to give back to everyone when you're taking the time to give data, but we are looking at some ways to try to have tele-research visits. And part of the question we're asking there is, what data can we collect in that format that is going to be meaningful and helpful? And that's part of what we want to review after having done this conference and done things in person, and sort of say, okay, how did that look? What does this look like across a range of patients, so that we're not wasting people's time at the end of the day. And so that'll be one of the ways. The other part of it is that there's going to be surveys that many people here at the conference have been asked to complete. So just parent surveys and parent report measures. And those will also be things that you can do remotely if you get involved in consent and go through the whole process.
And so to just elaborate a little further on that, as long as you have internet anywhere in the world, so I know it's a barrier, and we will try to help you with that actually as well if you don't, but as long as you have internet and an email address, it's pretty easy and we know most of our families for Ring14 and AP are not physically here. And so we fully recognize that, right? Because then we're just getting a small picture of the disorders. And so it will be pretty simple. And then we're also accessible to have a consultation by phone, by Zoom, to walk you through the informed consent that you'll have to actually understand and sign digitally. So you sign that electronically on the computer or your tablet or your iPhone. And then you can opt in and you'll see this is a survey questionnaire, and you can click on it and answer all of those questions. So for all those that are listening in virtually right now, it should be pretty self-explanatory, just like filling forms online. And then there's a lot of other optionalities that we'll be putting out there where you can put all your, I mean, we had a conversation with Matrix and it said medications. And we said, well, what about those that are on vitamins and supplements? We're not necessarily on prescription medications. And how can we organize that so that we have it all digitally in one place? And so there's some bells and whistles that we're really excited about as well. So that all of this information is just easy in one place for you, like in an app basically, or web-based. You have a URL and you go into it and you can have all of this information, and then ultimately really to compare your experience. So how many people are constipated like me, and be able to see a pie chart or a bar chart and say, oh, I'm not the only one. Everyone can't poop. And being able to kind of compare where you are at, like, oh, my child is having some trouble with their vision. And how many others in this group have the same challenges. And so that's really to help all of us basically exchange our own experiences so that we can help each other and help ourselves, and then share that with our clinicians and say, oh, look, it's not just me. You know, I answered my questions about my child, but I can show you a comparison right here. Everyone is experiencing this, so that it no longer is this black hole of, I'm so sorry, I've never heard of 8P, I've never heard of Ring14, I can't help you. Let us help you. And then I think the clinicians really can be the best, you know, sources for us as well. So I hope I addressed that, but really, I think I'm so excited. 21st century technology, who would have thunk it? But there's a lot of possibility there. Any other questions? The party time? Is it party time, or do we still have more stuff? We are decompressing now. Thank you so much, Jason and Scott. We really appreciate it so much.
Thank you, all of you.
And I did want to say we have more members of the team, Mark and Andrea, a Matrix in the back, and they've been great. And so please, if you haven't stopped by, they have a desk right next to registration, and they can answer more questions for you, and as well as the team from Children's Hospital of Colorado. And now we are decompressing. You guys are so wonderful.